Holy.
This little guy. Oh my gosh.
Oh, he's pulling out a splinter.
I guess the X-ray wasn't kidding.
See what they.
Oh my
Oh!
This
Close
is
your
a
eyes, close your
great video.
Close your eyes.
This
Close your
is
eyes.
that we got that on video.
That's not a splinter. That's a tree branch. Oh, you're pulling out an ingrown hair here. Look at that. That's long.
Okay.
He's got a
No.
hairy cheek there. There we go. Wait, you going back for more? There's more. Oh, look at how long that is. Oh my gosh, how satisfying. An ingrown hair is hair that grows underneath the surface of the skin. Now this can occur due to trauma around it. I see ingrown hairs when we perform tummy tuck surgeries all the time.
One more tummy tuck should take care of it.
And the important thing is that it keeps on growing, so sometimes you have to do this. You have to actually pull it out. Ideally, you want to see a professional if it really is becoming a problem underneath the surface of that skin. This looks like this looks like an abscess of his cheek. Oh, look at all that pus. Now, an abscess is a collection of pus underneath the surface of the skin. This guy needs to see a doctor to get on some antibiotics right away. Oh, the belly button. We see, we gotta clean belly buttons in surgery all the time. And the stuff that we find in belly buttons can be so disgusting. It's a combination of dirt, dead skin cells, oil, and sometimes like food can even get stuck down there if somebody's eating without a shirt on. Ooh, isn't that gross? The moral of this story is, before you go to surgery, clean out your belly buttons. Ugh, that looks painful. Oh, doesn't that look painful and inflamed? Oh, yuck. This is most likely hidradenitis suppurativa, and this is when you get blocked hair follicles, typically occurring in the armpits or the groin, that can create these painful lumps on the surface that can get infected like this.
Beautiful nature.
Oh, smell, that's infection. That's
High classness.
There are many treatments for hidradenitis, anything from steroids to antibiotics to surgery. If you've got a problem like this, one thing you may want to try is something called Miradry. That can help destroy hair follicles and sweat glands in the area, and that might help reduce the hidradenitis as well. What is this? What are they squeezing?
Oh, dear Lord.
Ah! Ugh. Ooh, this looks like probably infected cyst. Look at that, it's like mustard coming out of a bottle. Ooh. When you see the redness around it like that, that is a sign that it can be infected. Instead of doing this by yourself, like by the pool, it looks like, see a doctor and have it done in a sterile environment and then get on some antibiotics. Ooh, ugh. This looks like a lip abscess. That looks really painful. This is potentially dangerous. Oh, ugh. So this is nothing to mess around with on your own. When your lip is that big, that's a sign of infection.
Your lip.
And in addition to it being probably really, really painful, this can be quite dangerous. So getting on antibiotics, maybe even IV antibiotics, and seeing a doctor to clean that area out is so, so important. What is going on? Is that a little cyst or? No, they got the two. Oh, it's a splinter. Ow, that looks painful.
I got a splinter.
My mom has a blackhead. Do you guys see
That's not a blackhead.
this damn blackhead on her back?
Looks like a cyst actually, maybe an epidermal
see.
inclusion cyst.
Oh my gosh, I think I need.
It's not infected
Oh
though.
my god, it bursted on my face. Look, some of it fell on my.
Oh. Those are the hazards of popping somebody's cysts. Now the important thing is that this cyst is not infected. You can see there's no redness around it, it's not draining pus, it's not super painful, it's just probably a little cyst. Ooh, that looks painful. Oh, ooh, look at, oh, it's spraying out like a cow's udder. Oh, yeah, oh. It's like it looks like an infected cyst, and look at the pus coming out. That's just, oh, nasty. So it's really important to see a doctor if you've got something like this where it's infected, you've got all of that pus that you're squeezing out of it, it's red, inflamed, especially if it's around the hands, because if you get infections that go into the deeper structures and compartments of the hands, it can be extremely dangerous. Ooh, yeah. No, this is not good. Oh, look at the pus draining out. This is an abscess of the eye. This is actually a very dangerous situation because infections around the eye can actually travel into the different compartments around the eye and even infect them.
Infect?
There are connections between the blood vessels in that area and the brain as well. This is a very concerning situation. He needs to see a doctor right away and get on antibiotics and get that cleaned and drained out professionally. Looks like he's got a big cyst, maybe an epidermal inclusion type cyst there. Ooh. Ooh. If I did this to my mirror, my wife would kill me. Oh my God. There's more? There's. Oh. This is a big cyst, and this does probably necessitate surgical intervention. This cyst will most likely refill back up with that cystic fluid. You actually have to remove all the walls of the cyst in order to prevent it from coming back. Did you enjoy watching me react to these TikTok pops? Well, if you did, please comment below and share this video to let me know that you want me to react to more TikTok pimple pops. I react to other types of TikTok videos on the playlist right up here, which is a lot of fun. And if you've been enjoying my videos, please subscribe to my channel and always remember, eat real food, use clean skincare, and only consider actual plastic surgery as a last resort.